It's fairly rare and can be very complicated. The general physician may not be very familiar on how to look after these patients, and that's why we exist, to provide that specialized care. Simplistically speaking, we're there to look after the patients so they don't end up in the hospital. We want to keep them in school, keep them at work, and be accessible.
When a patient comes for an appointment, we have been in contact with the patient, getting their appointments set up, making sure they've got all the labs that they need to have drawn. If they need to see any other services while they're here, I make sure that their appointments are coordinated.
When they come up to the Hemophilia Center, they will be roomed by our clinical assistant staff, and they'll get vital signs, so height and weight and blood pressure. The nursing will go in first.
My name's Amy. I'm one of the nurses in the Hemophilia Center. I'm glad you could come in today.
An RN care coordinator in the Hemophilia Center is responsible for all aspects of coordinating patient with bleeding disorders care, from regular checkups to managing surgeries.
Our center has 3 nurse coordinators. One works with the adult male population, one with the adult female population, and then one works with the pediatric population.
I know, the tigers made me see them. They're so far up there.
We always have a social worker available in the Mayo Clinic Hemophilia Center as well. So if you're having insurance concerns, medication cost concerns, or any social concerns, she can tell you what resources are available.
What I do is kind of look at what their coping mechanisms are, how they're handling their stress and their challenges in regards to their bleeding disorder, and I'm able to connect them with resources and services and provide education to them that will help them in managing their care throughout their life.
If you have any questions about that, feel free to give me a call.
At Mayo, we have many specialties. Those services are available for us to refer our patients to.
We set up appointments with the right subspecialty. So we get them to the right surgeon or the right medical physician.
We're such an integrated team, both in the clinic and in the hospital. Everyone is at the table together.
Can you do this? Oh, good job. What about on your back? Look at that. Yes.
We realized at Mayo Clinic that it's a lifelong disease with transitions of care that are very important. In our center, we're a combined adult and pediatric hemophilia center. We have pediatricians and adult hematologists that look after patients.
We see patients across the lifespan, so they're not having to transition to a different social worker or nurse or doctor.
That patient's going to have the same team of nurses when they're 2 years old or when they're 75 years old. It really provides good continuity.
We're always providing education to them. It starts at the time of diagnosis, teaching them about their bleeding disorder as they progress through life stages.
We work directly with the school nurse as well as any other staff at the school to educate them about hemophilia because it is a rare disease. By providing that piece of education, parents can feel maybe a little more at ease about sending their child to school, knowing that they're going to be safe, knowing that there's a plan in place, and knowing that staff at the school are on the same page as a team working with our hemophilia center.
The big advantage of coming to Mayo Clinic is we have our coagulation lab right here. Not all centers will have that availability. We can perform all of our tests on site to get the results back as quick as possible.
Our lab is fully integrated in the hemophilia center practice. That combination with the expertise covering both laboratory and the clinical practice is extremely unique and highly important for our mission.
There's a huge interplay between the lab and the clinical side, especially in coagulation. You need to have a good lab because otherwise you can't interpret what the data is coming out.
We're able to efficiently order blood tests so that we can monitor patients' response to the factor concentrates that we're giving them and provide it in a cost-effective manner. That's the whole goal of our existence.
Life expectancy for somebody with hemophilia now is normal. You can lead a full, rich life. Things are going to be okay. Things are not what you planned, and things maybe are going to be a little bit different. We're going to help you move through that and connect you with what you need, and we're here to support you and help you along the way.
We give management strategies and maybe medications if need be. That's regaining control and like, look, I can work, or I can go to school, or I am able to make social arrangements.
I think the most important thing is for patients with a bleeding disorder to have a contact that they can count on and have confidence in, that someone is going to be there to answer their questions. The Hemophilia Center is that contact for our patients.